Hello and welcome. Thank you for joining us today on this webinar, which is all about how to secure patient-generated data and achieve ROI in this new age. So my name is Jack Murtha for Inside Digital Health, and I'm going to be your moderator today. But before we go on, I just want to note that this is an interactive webinar. So what does that mean? We want to hear your questions. If you have any thoughts or anything that's not clicking or any lingering concerns, please feel free to send them over via the questions box on the side of your screen. So just a reminder that this is an Inside Digital Health webinar. Inside Digital Health, if you don't already know, covers health IT and kind of all of its implications, how it's changing the modern health system, patient care, and the world. The big idea is we cut through the hype to deliver actionable insights to health system decision makers. So be sure to check us out online at idigitalhealth.com. And of course, you can find us on Twitter, LinkedIn, and Facebook. Also, please give our podcast a listen. It's called Databook, and you can find it on your favorite podcasting app. So, enough of me, right? Our expert speaker today is the esteemed David Harlow. David is a healthcare attorney with deep experience in business, strategy, policy, compliance, and proactive counseling. So David works with all sorts of provider organizations and tech companies. He is, of course, a major thought leader in digital health, data privacy, and healthcare at large. And that is in no small part due to his passion for this space for health IT and the practical kind of actionable approach that he takes, which is why, along with his legal acumen, that we wanted to bring David onto this platform to help you craft strategies that will further patient care and your business. You probably already know David. He is the author of Health Blog, and he also hosts the podcast Harlow on Healthcare. David is a big contributor on Twitter, and in general, an all-around knowledgeable and nice guy. So, David, thanks for joining us today.
Thank you very much, and thank you for that kind introduction.
Yes, David, so why don't we dive right in? How about you give us a brief overview of what we're going to tackle in this webinar?
Sure, thank you. So let's start by thinking about the opportunities at hand for the use of data. And what is it exactly that we're talking about? I would have to say that digital health is one of those things that's maybe a little difficult to define. But let's think about what digital health can include and can enable. As a starting point, I'd like to refer to a recent McKinsey report that highlighted 6 aspects of disruption that may be enabled by digital health, some sooner than others, I suppose. The reason I want to discuss them is in order to provide a framework for thinking about some key issues here. Why is data important in healthcare? What kinds of data are we talking about? And what are some specific things that we can really do with data, whether today, tomorrow, next year, 3, 5, 10 years from now? We've all made tremendous investments in health data and in digital health tools, one way or another, either directly through our organizations or collectively through the tremendous federal investment in digitizing health records and in seeking to create a digital health ecosystem. There are also, of course, a host of other sorts of data being collected and used, as we'll discuss, that have the potential to be of use in serving patients and in managing their care. But let's dig into those 6 areas of opportunity highlighted by McKinsey. I'm going to start with longitudinal patient data. We usually have that internal to our organizations on the clinical front. on the financial front, but can we connect those and really create a longitudinal record, including also other kinds of data, social data, home care monitoring data, self-care monitoring data, data on activities of daily living, in addition to the sort of the traditional healthcare data that we're more familiar with. Second area of opportunity, advanced analytics, where we can generate insights for patients and their caregivers, whether professional caregivers or otherwise. Thinking about the opportunities for using data in continuum of care models, the digital tools that can collect and use this data, home care settings, traditional healthcare settings, where we need data in order to really connect the dots. Next, device-enabled autonomous care and cognitive engagement, really device, whether it's your phone or something else that is helping you manage your care at home. Next, real-time refinement of individual care solutions, the whole promise of personalized medicine. And next, and finally, the seamless integration of monitoring and care amongst clinical caregivers, social and community structures, and family members. So that's the promise, right? That's not something that's all going to be realized tomorrow, but that's what we need to be shooting for, I think, as we think about the data that's within the walls of our organizations and the data that we need to have access to from beyond our four walls. We need to harness this data, right? McKinsey and others have made the business case for using technology in healthcare, suggesting that technology-enabled clinical operations, improved disease diagnosis, and identifying gaps in care could save up to 3% of our annual healthcare spend. And for those of you out there who are at risk, then that's a potential 3% savings, a 3% improvement to the bottom line. In order for that to happen, we need to build a strong foundation. We need to build strong infrastructure, not only on the technical side, but on the policy side and on the human capital side as well. We're going to talk about a range of different types of data, whether it's traditional electronic health record data or patient-generated health data of a variety of sorts, activity trackers, other sorts of data. There are different kinds of regulatory frameworks, as we all know. The big bad one, of course, is HIPAA. We have other federal frameworks, Federal Trade Commission. We have 50 laboratories, our wonderful system of 50 laboratories, and at least half of those laboratories have their own approach to patient data, privacy, and other sorts of regulation. California is on many people's mind, the CCPA, but there are also other existing state regulatory structures that have some strong things that we need to think about. Illinois, other parts of the country as well. And we need to think about risk. What are the risks that we face in dealing with patient data? And how can we mitigate those risks, right? We've all heard about the myriad external risks, the breaches, the attacks that happen not only in the healthcare sector, but in other sectors throughout the economy. Recent breaches that we've all read about and heard about include the Capital One breach, include the LabCorp and Quest billing partner breach, include the ransomware situations that have involved municipal organizations throughout the country, as well as hospitals and medical practices. Internal factors that, in a sense, open the door to some of these external risks are, I think, the most important one to think about is human factors, right? We are all fallible human beings. How can we protect against every possible risk? It's almost impossible. So there's a tremendous effort that needs to be made, an investment that needs to be made in our people, because our people are our front and sometimes only line of defense against the bad guys. We can certainly have a number of technical solutions in place, but many of these big breaches are enabled by sending a pretty spiffy looking phishing email to an individual who clicks on something they shouldn't have. That is the common thread for many of these things. So we have some pretty amazing opportunities hovering out there just within or just beyond our reach. And we have a host of challenges and potential blocking factors between here and there. Regulatory factors, structural factors, and the data security risks that are now part of our daily news. So with that, I'd like to engage in more of a conversation, dig deeper into some of these areas, and see what we can identify as opportunities for improvement in the future.
Excellent. So, David, that's exactly what we will do. Let's dive in a little bit more into the potential of patient-generated data, because look, at Inside Digital Health, we know that this is a revolution that's not just coming; it's already starting to happen. But this is our area that we focus on every day. Now, to bring this home to health system leaders, I'd be interested if we could kind of discuss an area where health systems are maybe struggling to do a certain task or hit a certain goal right now, but the proper use of patient generated data could change that and could help them hit the key objectives that they need to hit. So, do you have any of those in mind, and could you detail them?
Sure. So there are some classic areas that are familiar to the healthcare sector, and they are popular largely because we have a lot of data, right? So a lot of the efforts in this arena have been focused on cardiac care and on orthopedics. Again, that is largely because that's where the data is. From the patient-generated data perspective, another arena where we see a lot of activity is in the realm of diabetes care, right? There's a tremendous amount of data that is generated and captured by persons with diabetes and shared with their family members, caregivers, clinicians, and others. There are growing areas of other sorts of data opportunities. And sometimes I think it's important to step back and think not only about the super cutting edge, what's the next sensor we're going to use? Do we have an activity tracker that's going to help us do X, Y, and Z? But even sort of taking a step back and thinking about how about something real simple. And just as an example, I read something recently about a texting program directed at expectant mothers, right? So pregnant women who can be risk stratified for complications, et cetera, and sent over the course of their pregnancies a specialized, personalized or personalized based on their risk strata, so to speak, uh, series of text messages. And the results are in at least one study, and this has been done by the government in the past to some good results as well. Simple text messaging to people based on their status and risk strata can improve outcomes dramatically. It's a pretty low cost intervention. It's not collecting a huge amount of data, and it has some real effect. So that's on one end of the spectrum. Somewhere else along the spectrum might be the sort of program that enables a lot of patients to avoid rehospitalization. One of these examples has to do with COPD. People may be familiar with this, where one of the risks post surgery, post-discharge is weight gain related to water retention, and that's a sign that interventions may be needed. So instead of coming back to the office for follow-up checkups, you can send a patient home with a connected scale, and when the patient weighs him or herself daily and weight is out of bounds, based on limits that are set by the clinician, there will be an automatic alert to a nurse case manager who initiates an outbound phone call to the patient. And this model can be extended to a whole variety of different situations. Opportunity for accurate measurements based on digital tools in the patient home, communication based on predetermined guideposts set by the clinician, and patient engagement, a direct phone call or text or whatever. In some cases, that the patient preference can be incorporated into the system, and an alert goes to the patient. And depending on the situation, perhaps an alert goes to a family member as well at the same time. So there's tremendous opportunities in a whole variety of situations to harness the sensors, harness the data that we can collect not only through the healthcare system but otherwise in the service of advancing health improvement for individual patients.
So it's pretty clear that we can see better outcomes and maybe even better preventive care, maybe even better results for the bottom line from these new streams of data. But now let's dig into the actual kind of data that we are discussing here. David, I think by going into this, it would be helpful if you could enlighten our audience a little bit about some of the most promising new streams of data that you see out there, and how they might be supplemented with existing streams of data, updates to them, kind of your survey of the field. We'd really appreciate.
Right. So genetic testing is a very interesting area and is considered to hold a great deal of promise. And the question is really, how can we correlate genetic data with other data that we have about a patient, right? So we can be talking about direct-to-consumer genetic testing, the over-the-counter direct-to-consumer sorts of tests, or we can be talking about specific genetic testing, genome sequencing ordered for a patient because of a particular genetic counseling process, and that can be correlated with other data in order to yield better diagnosis, better treatment recommendations, etc. This can also go into research and improving the knowledge base for all of us, because in some cases we're talking about extraordinarily rare situations, and the genetic data tied with the patient specific clinical data or other patient generated data can be quite useful. Now, I homed in on the genetic testing because I wanted to talk about a certain category of patient-generated data that we don't necessarily think about as patient-generated data. It's not coming from your activity tracker, smartwatch thing that you're wearing, or other devices. It may be coming in or available or accessible because people post on social media about their healthcare conditions. And if that can be analyzed together with genetic data, clinical data, other sorts of information streams, then there's a tremendous opportunity to get a richer picture of a patient. Now, that's not necessarily something that's going to be done in every hospital or health system around the country, but it's an opportunity, number one, for research, number two, for development of better diagnostic tools and treatment pathways coming out of that research, and also greater opportunity for patient engagement in their care, particularly if there is a condition-specific online discussion group that people know in advance is going to be available to researchers or to companies, et cetera, to advance work on their particular disease state. I think that's a tremendous opportunity. Remote patient monitoring, we talked a little bit about already in terms of the COPD, having a connected scale at home. Obviously, there are many other sorts of vital signs that can be collected by wireless device in the home and shared into the health record and alerts configured. So if something is out of bounds, then a nurse case manager or other clinician can be alerted. Obviously, none of us wants to have everybody's full data stream coming across our desktop, right? And I understand that and appreciate that. However, there's value in getting that stream and configuring things so we can pick out the signal from the noise and take action where previously we might have been unable to have access to that signal in any way, shape, or form. So it's a tremendous opportunity.
Excellent. And David, are there any examples of data that do not apply to the conversation that we're having today?
Well, I think we don't know the answer to that, right? So we may think we know that things are not relevant, but in the future we may find that in fact the stuff that we were discarding is in fact the critical linchpin that connects to causation or to hereditary disease or something else. And the benefit of the tools that we have at our disposal today are that storage is cheap, computing power is cheap. We can use what are called unsupervised machine learning algorithms, unsupervised machine learning in order to delve into pots of data and try to yield some understanding. So here I'm talking more about research, but the point is that we have the ability to collect a lot of data cheaply. And on one side of the coin, I say, why not? We should collect as much as we can because you never know. And we have the tools to store and analyze that much more cheaply than we have been able to before. On the other side of the coin, I say, wait, that is all personal data. I want to minimize the data that I want to have collected about me. If you don't really have a good reason to collect it other than, gee, it might be nice, or this is some science project I'm working on, maybe I don't want to share that with you. So from the patient perspective, we need to be able to articulate a good reason for collecting information, and we need to be able to articulate the way in which we're going to treat that data with great care from a privacy and security perspective.
I think that's a great segue to the next point in our conversation, regulatory frameworks. So as everybody in this space understands by now, hopefully, HIPAA was created years before we could comprehend some of these technologies and the new streams of data that they would bring access to. So to kick off this conversation, I have to ask David, what is the role of HIPAA in all of this?
Sure. So everybody loves to hate HIPAA for a variety of different reasons, but I think that it is actually a pretty darn good framework for what it does, and acknowledging that it addresses a limited situation, a limited set of data being touched by a limited set of actors, right? HIPAA relates to personal health information that is touched by covered entities, meaning essentially healthcare providers or health plans, or their business associates, data contractors who touch that data. The way in which HIPAA is constructed is through a series of standards. Some are quote unquote mandatory, some are quote unquote addressable, which means it's not a one size fits all set of regulations. It can be very flexible so that an academic medical center or a national health plan have a certain level of approach to data privacy and security, and an early stage digital health startup that may be contracting with some of those may not need to have the same full-on approach from day one. Obviously, as they scale and are holding tremendous amounts of data on tremendous numbers of patients, they should be adhering to the same sorts of standards. But it is scalable. And HIPAA is a floor. It's important to remember that HIPAA is only a floor. There are state privacy laws across this great land of ours that differ. There are statutes, there is case law, there are a whole host of different approaches to privacy from state to state. And those privacy approaches deal not only with the protected health information that is covered by HIPAA, it also covers all sorts of other kinds of information, other information that might be collected by our phones, by our activity trackers, by other devices that we have with us. And unless and until those are incorporated into a health record held by or on behalf of a covered entity regulated by HIPAA, those data are not regulated by HIPAA. So let me be clear. They may be regulated by states, or they may be regulated solely by the Federal Trade Commission and its approach to regulation of personal data. And it takes a different sort of approach. It does not have chapter and verse to cite. It basically has one broad rule and one broad rule only. And that rule is, do not engage in an unfair business practice. And it
Now,
elaborates on that point from a personal data perspective through its case law.
now, David, I love the point about states that you're making, and we have a specific piece of legislation to discuss here. Can you tell us a little bit about the California Consumer Privacy Act and its implications for this type of use of health data?
Sure. So, surprisingly, it may have little effect on the use of health data by covered entities, meaning covered entities under HIPAA, because there's a HIPAA carve out. And the California law basically says, if you're covered by HIPAA, you're covered by HIPAA, the end. If you're not covered by HIPAA, or if you're covered by HIPAA in one situation, but you're dealing with other kinds of data for other kinds of relationships, then you are covered by the California Consumer Privacy Act, right? So, for example, a healthcare provider has a ton of information about its patients, right? All covered by HIPAA. It also has a ton of information about its employees, not covered by HIPAA, covered by the California Consumer Privacy Act, as well as other state laws and perhaps some other federal laws as well. So it's an elaborate Venn diagram that we need to draw, designating who's covered by what in what circumstance. Now, another twist to all of this is we've discussed activity trackers as an example. So if I am the manufacturer of an activity tracker and I sell it to someone living in California, the data that's generated by that tracker and that ends up on my server is going to be governed by the California Consumer Privacy Act. And in many respects, that act is a mini GDPR, meaning it follows some of the European approaches to a broad stroke privacy structure. But again, you could have the same device on the wrist of the same person, but if it's purchased by the individual in the retail channel, then it's governed by the California Consumer Privacy Act if I'm living in California. If, however, that same activity tracker is given to me by my health plan or by my hospital, and that data is accessible to the health plan or the hospital, that now comes within HIPAA, and it's carved out of the California law because it is personal health information that is going to a covered entity.
So broadly, we can say that health systems need to keep a close eye on what's going on in their individual states. There's movement happening here, as data privacy enters the mainstream conversation more and more. It's possible we'll see more of this at the state level, and in this arena especially, minutia matters. It's not just minutia. But David, what about the national stage? What can health systems expect to come down the pike in terms of federal regulation, if anything, at this point?
Well, I don't know if expect is the right word. I think hope is maybe the right word here. There's been a great deal of hope expressed by industry, and by industry I mean starting with the Googles and Facebooks and Amazons of the world. There's a great desire to have a uniform federal law. I mean, think about it. If I have X tens of millions of customers in California, but I have hundreds of millions of customers elsewhere in the country, I now have multiple sets of rules that I need to follow. Wouldn't it be nice to have just one? So industry has been lobbying Washington for a uniform federal privacy law that would preempt the California law, hopefully before the California law goes into effect on January 1 of 2020. I think it's unlikely that a comprehensive federal privacy law is going to be enacted on that timeline. I think the odds of that are really, really low. There are some federal privacy bills advancing in different stages. There's probably a dozen different bills that are either circulating as discussion drafts or actually filed legislation. But again, the likelihood of that happening anytime soon is pretty vanishingly small.
So all of our betting folks out there can take that home and maybe take it to the bank this weekend. Now, moving on to risks. There's obviously a ton of potential here, but health systems have to be concerned with their liability. Broadly, David, what do health systems have to lose by engaging with making use of patient-generated data and these new streams of data?
Sure. So there's so many different possible problems. Number one, from an IT perspective, is going to be sort of security of the network. So we try to not connect external things to our networks because that's how we get bad stuff, right? We all have seen warnings on emails coming from external sources. You know, don't click on anything here unless you really, really know who is sending this to you and you were expecting this email or something like that. Because as I said earlier, many of the most significant breaches have been caused by staff members clicking on email attachments that have then gone on to infect the network, right? So that's a significant risk. And we can talk a little bit later about some of the mitigation that can be put in place for that and other risks. But that's a risk. So security risk, the risk at an organizational level are obviously manifold. There would be the cost for remediation, the cost for future mitigation. There's obviously a reputational cost. If you're trying to promote your brand in the community and in the marketplace, and you're hit with one of these catastrophic breaches, then that's a significant risk. And again, it's a non-standard type of data from the healthcare environment's perspective. So the risk there is sort of a cost. What is the cost here that we're talking about? You need to engage in a cost-benefit analysis. I think in the long run, it's going to be worthwhile being able to incorporate additional types of data into your systems, but that's an upfront cost of configuration. There's great hope and great promise today, but unsure whether this has been realized yet. The whole brave new world of FHIR and APIs and the ability to exchange data from one system to another. That starts with mapped health record data to mapped health record data, but in the future we're going to need to bring in other types of data and think about how to map that, and that's an industry-wide conversation that needs to happen. It's not only patient-generated health data from trackers or other sources, it's other kinds of data that are accessible to the healthcare community. It's other kinds of data that we don't necessarily have a framework for storing and sharing. So we need to work on that collectively, again, to realize the full benefit. The human factors, I think, are key, as I keep saying, and also the question of how do we govern this data, the data governance question. Part of it is the issues that I've already touched on, but also a question of within the organization, who has access to what? For what purposes are different types of data going to be used? Do we have all of the consents in hand from the patients that we need to have in hand in order to satisfy HIPAA, FTC, applicable state law, et cetera, in order to use the data in the way we think we want to use it? So that's an ongoing discussion. It's an iterative process, just as hardening privacy and security protections is an iterative process, because this is all a moving target.
Great. So let's move on and discuss best practices. I think a point that you made that was pretty salient was the cost-benefit analysis. How do you, as a health system, begin to figure out, hey, is this going to be a program that ultimately delivers for my patients, for my physicians and clinicians, and for the enterprise as a whole? David, do you have any insights into that?
Well, yeah, it is a key kind of question, and that's going to the answers And even the metrics for consideration may vary from place to place because of different local conditions, priorities, or your existing current state of affairs, right? So someone who has already achieved a high level of technological development and integration, it may not be as heavy a lift to go to the next step of being able to integrate into the record data about social determinants of health, for example, or other sorts of patient-generated data or other data collected from outside the healthcare system, or even data collected from, the other system across town where the patient has been seen. Some of these basic blocking and tackling things have not been addressed consistently by every healthcare organization. And as always, there are competing priorities for investment. So that's always a challenge, right? Can we dedicate funds to preventive strategies so that we don't have to deal with an emergency next year? It is sometimes difficult to articulate that need. Often, the spend comes only after the breach. It is my hope that folks can articulate the need in the business case based on, again, the stories that we see in the paper every day, that the investment is in fact worthwhile now versus later in order to avoid being the next story above the fold about the massive data breach. Again, I keep coming back to human factors, training, testing, creating real world situations that test people, like the fake phishing emails, sprinkling some thumb drives around your facilities and see if anybody picks them up and plugs them into a computer that can generate a message. Either the email clicking or the USB drive use can generate a little kind gotcha message to the employee or contractor who uses them, and use that as an opportunity for re-education. More broadly, the investment in education generally should be focused on being differentiated by job function. Many times we see canned HIPAA trainings, other sorts of trainings that go out to everybody at every level of a organization, and it would make sense to me to have more segmented training. Speaking of segmentation, systems should be segmented. That's really a technical opportunity for reducing risk, so that someone who manages to get a password to the payroll system doesn't necessarily have the keys to the kingdom across all systems. If I'm not mistaken, I think there was a significant hotel industry breach that started with a temperature control system for a fish tank. Once you're in one system, if they're not firewalled internally, you get into every system.
And that is terrifying. So, David, at this point, we got about 15 minutes, a little less, left in the webinar, and we're going to move on to audience questions that we have received from Twitter, email, and I also want to just make a point to the viewers right now. If you have any questions that pop up, please, again, feel free to send them over in the question box in your GoToWebinar panel. David, the first question that I'd like to ask you from an audience member is this. It seems pretty straightforward. Does using patient-generated health data open me up to liability risks that wouldn't exist otherwise?
So when it is collected by someone other than a healthcare provider, it's sort of a different set of regulatory concerns, right? I talked about state rules, I talked about the Federal Trade Commission, but once it comes in as part of a health record, then that is covered by HIPAA. So it is not a different regulatory risk, but it is a different set of practical risks because it's a different kind of data coming in in a different way. So those need to be properly configured and secured. You need to have policies and procedures in place that govern that data transmission, use, and storage, and it's going to be perhaps slightly different from your existing policies and procedures governing the EHR, unless it is able to be slipped in directly to the EHR system.
Great. So here's another question that we received from Twitter, and I think it was geared more toward vendors, but hospitals must deal with vendors. So, David, when a hospital is dealing with vendors, what should they look at in terms of the terms of use that the makers of the equipment are willing to offer that will give consumers confidence that their data will be private, secure, unmined, and not sold?
Right. So these are, the terms and conditions are often buried or often not read by anybody, but at the end of the day, they become important for reference when we think about who has what rights to which data. I think that in making the decision to roll out the use of a tool or to incorporate data collected through a particular tool, any healthcare organization needs to do a comprehensive risk assessment, right? And part of that risk assessment is going to be reviewing the terms and conditions. It's also going to be reviewing the way in which the data is hosted, encryption standards, et cetera, et cetera. But terms of use are going to be an important part of that review as well. Terms, privacy policies, depending on the type of application, there are a variety of model terms that are out there. There was actually a crowdsourcing competition sponsored by OCR, I believe, relating to personal health data privacy policies. So there's some interesting information on that front that's available. And they're interesting tools. The other important thing, whether it's HIPAA or non-HIPAA related data and communicating policies to individuals, I think it's just really important to focus for a moment on the need to make sure that those policies and procedures are readable, are understandable. Sometimes the preferred approach is to use a layered notice to individuals. So you have sort of the highlights, hot buttons in a simple to read short piece, and then for those who want to dig deeper, you can read the 20 pages of small print by clicking through particular sections.
Mm-hmm. Sure, that seems like it would be a much more effective process. Now we have another question from Twitter, again related to the vendor side and what health systems should look out for. Will these vendors register their equipment on the ONC model privacy notice tool?
Right. So this is the model privacy notice that I was just talking about. And I think to the extent that a health system is in a position to encourage or demand a vendor to use that approach, I think it benefits the individual end user, and it ultimately benefits the health system as well because it will have happier campers on its hands, so to speak, people who are not surprised by the way in which data is used because the uses of the data have been explained clearly and carefully through the use of this model notice.
Another question for you, David. What does it mean in terms of liability if a hospital were to send the data back to a patient through a portal or a mobile app or anything like that?
So if I am the patient, I have the right to my data, right? That is one of the fundamental pieces of HIPAA, right? And I have the right to receive that in the way that I want to receive it. So if I direct a healthcare provider to send me a PDF by insecure email, that's fine as a matter of law, federal law. If I want to say, can you put it into a spreadsheet, a Word document? Can I pick up a CD with that information burned on it? Whatever. That's my right as a patient. As a practical matter, many healthcare organizations establish barriers to access to data for their patients. And there's an ecosystem of companies now that have gotten into the business of helping patients request data and obtain it in the way and in the manner and in the format in which they want it. And so long as it is reasonably practicable for a healthcare provider to deliver information in a format that the patient requests, they're supposed to do that under HIPAA. And once that data leaves the building, so to speak, it is the patient's risk, right? So data comes in from wherever to a hospital record. Could be from a lab, could be from an activity tracker, could be from a consulting radiologist, whatever. Once it's in the hospital record system, it needs to be maintained in accordance with HIPAA privacy and security standards. Once a patient requests it and it goes out to the patient, the copy that's in the patient's possession needs to be governed by the patient, right? So once it goes out, it's not the responsibility of the healthcare provider, the covered entity.
Great. And David, I have one more quick question for you. It might be, this might be for a part 2 webinar, but how can health systems enable clinicians to use patient-generated data like wellness and home monitoring data alongside discrete clinical data? This Twitter user says that they generally don't meet up in the EHR. They're not commingled, they're not visualized together. Do you have any insights into that?
Right. I mean, that's a challenge because the electronic health record systems have been built to spec, so to speak, to meet the Recovery Act, the HITECH Act requirements, and those requirements did not necessarily include what we're talking about. We're now talking about sort of next generation functionality, and that is going to be realized through a combination of evolution of the EHR systems, evolution of the interoperability ecosystem, so to speak. We're talking about the trust framework, and we're talking about the systems that are out there already, Commonwealth and Care Quality, which are interactions between healthcare providers, so you can get data from here to there. But those ecosystems need to open up so that they can accommodate other sorts of data, other data streams to enable a clinician and a patient to have a shared dashboard that includes clinical data as well as patient-generated health data.
Excellent. And David, before we let you go, we'd appreciate it if you could give the audience a couple of key takeaways from today's webinar so that they can walk away from this and return to their jobs and take action.
So for me, I think that it's important to think about what are the kinds of data that I would like to have about my patients? What are the kinds of data that are missing from my records about my patients? And this could be activity data, this could be genetic data, this could be social determinants of health data. Those are all categories of data that are often missing and often could help clinicians and health plans and health systems tremendously in delivering more appropriate, more holistic care to their patients. So that's thing one. Thing two is how do I make sure that my systems are really secure? Because given the data that I have today and given the data that I want to have tomorrow, none of this is going to matter if we get hit with a severe ransomware attack. We've seen physician practices decide to go out of business rather than trying to deal with their ransomware attacks. We've seen cities, major cities in this country, have systems taken down for significant periods of time, bringing certain parts of their economic life to a standstill. That's unsupportable and unacceptable in the healthcare context. So we really need to figure out how to harden the perimeter and how to do that both in terms of from a technical perspective as well as addressing human factors. If we don't do that, then we're going to be perpetually playing catch up on the security front, and we're not even going to be able to have a conversation about privacy or a conversation about achieving next level goals in terms of using data, integrating data in order to improve health and healthcare.
Excellent. So David, I want to thank you so much for joining us today and really carving a path forward for how health systems and healthcare leaders can leverage these new streams of data in this new day for healthcare and society at large. It was a pleasure having you. And to our listeners out there, thanks for joining us. If you enjoyed this webinar and you got something out of it, please remember that you could check out Inside Digital Health at idigitalhealth.com. You could also find us on Twitter, LinkedIn, Facebook, and we publish a podcast every other week called Data Book. Please be sure to give it a listen. David, thank you.
Thank you.
All right. Have a great holiday weekend, everyone.